Heart Health Radio.
This is Heart Health Radio, which you can listen to on Apple Podcasts or at hearthealthradio.com or on FM 98.5 AM 680 WPTF. I'm Dave Alexander. This is Dr. Franklin Weefald, and joining us is CEO Gavin Densmore of At Home Eldercare. Gavin, good to have you in the studio.
Thank you for having me in today, gentlemen.
Yeah, it's all right.
Well, I when I was in residency, we had something called the VNA, the Visiting Nurse Association.
Oh, yeah.
And we would say, get the VNA involved. But nowadays, it's much more extensive and much more comprehensive. And so, Gavin, tell us about your company, the services you provide, and the kinds of things that you can do for our people who are at home and need care.
Well, Dr. Weefeld, I'm happy to. I've been in the business for 21 years.
Good for you.
And senior care is an absolutely exploding industry.
Well, because we're all getting old. I mean, let me tell you, the number one fastest age group in this country growing is what? 100-year-olds.
Yeah,
100-year-olds. And there are over 100,000 100-year-olds in this country. And the 90-year-olds and everything else. So it's an amazing thing. And, keeping people at home when they can is a wonderful thing. I interrupted you. Go ahead.
No, that's fine. It's called aging in place. And
I like that term.
I do too, because it's where they want to grow old. They're surrounded by their memories, their possessions, and that's where they raise their families, and that's where they'd prefer to stay for as long as safely possible.
Absolutely.
And we help them in doing so.
Great.
We send not VNAs anymore. We send in certified nursing assistants.
Right, CNAs.
Or companions.
What's a companion?
Well, a companion is somebody that's going to help out the family member with linens, medication reminders, transportation. They're not going to do any hands-on care.
We used to call them home health aides.
Yeah, we still call them home health aides.
I like the term companion.
Yeah.
Well, I'm concerned because I think you want to hire these people just to come into your house.
I would like.
You're not. You need some help.
I've got two companions.
No, I mean you need help on some of these issues.
Yeah.
But I don't want you to call them, okay? Because your service is for folks who are senior. Right. He's not qualified yet.
Absolutely. He doesn't look like he could use our help.
No,
listen, I can use all the help I can get.
And Dave, to your point, we have my previous company that I founded back in 2000. Believe it or not, we were the home care agency of choice for the Brain Injury Association of North Carolina.
Oh, there you go.
So yes, predominantly, Dr. Weefeld, most of our clients are 75 and over. But we would have cancer patients, we would have brain injury patients. So we take care of the younger folks as well. Yeah. But generally speaking, the focus is on seniors and certainly keeping them out of nursing homes and keeping them out of assisted living facilities and keeping them at home where they want to be. And we can help them do that anywhere from 4 hours a day all the way up to around-the-clock care.
Do you generally hear from the doctor referring you or the patient to you, or do you hear from the family?
Generally, the largest referral source in our industry is case managers and discharge planners from hospitals.
Now, is it still true, because I don't do this much anymore, that you have to be an inpatient for a certain number of days to get into a nursing home, but you don't have any requirements, or do you, to get into at-home elder care when you're discharged?
No, we can typically, doctor, one of the concerns is if the patient is going to require rehab afterwards, then they may be sent to a rehab facility.
Right.
What a lot of folks don't know is that they can get rehab at home.
It's fantastic at home.
And there are organizations, Sure Steps here in Raleigh I like Sure Steps because they actually go to the client's home and they have a focus on the geriatric population.
Uh-huh.
And I think geriatric rehab is probably a little different than rehab for an 18 or 20-year-old.
Absolutely.
So
that's not part of you.
But that's no. That's outside of our wheelhouse.
Okay, so let's talk about I'm 75 and I need your help. What can you give me?
Well, we can assist you. As I tell my clients, Dr. Weefeld, the sky's the limit. There are only two things that we cannot do for you.
Okay.
Number one, we cannot do wound dressings, and we can't change dressings because our employees, so they are our employees, are not nurses.
Okay.
And we also cannot administer medications.
Right.
We can remind you to take your medications.
Right.
We can get them out of the pill box for you and put them in your hand, but you have to get them from your hand to your mouth.
Okay.
But other than that, the sky's the limit. If you need assistance with toileting or ambulation, bathing, dressing, meal preparation, linens, transportation, pretty much the sky's the limit.
Yeah. So I had a similar situation. My mother had dementia. And for the last 6 or 7 years, I mean, she really needed 24/7 care. Now, I paid for that out of my pocket. Are your services covered by insurance and Medicare?
No to Medicare.
Okay.
There are long-term care insurance policies that
Right.
folks our age should probably be looking at purchasing now
Absolutely.
for when you're 85 and you need them to pay off.
Right.
So generally speaking, the payor sources in our industry are private pay, much like you did with your mom. Veterans Administration pays benefits for those.
Oh, I didn't know that.
Yeah, for VA. Absolutely. The VA will pay for services.
What a wonderful
for this.
thing for our veterans.
It is. We can't do enough for these folks.
Yeah.
I was about to say guys, but there's a lot of women that serve too.
I have a lot of women vets.
Yeah, we can't do enough for our veterans, and Medicaid pays for it as well.
Okay.
So Medicare does not, but Medicaid does.
Okay. So the things that you would do, you get called, is that right? And you go out to the home and you make an assessment first of what they need and what you could help them with?
Yes, sir. My director of nursing is going to go out, or our directors of nursing are going to go out. They're going to visit with the family. They're going to visit with the care recipient. And depending on the situation, we always like to have family there to be involved with that initial assessment. From that assessment, my director of nursing will develop what's referred to as a plan of care. The plan of care is what the employee is going to do day to day for that client. It's the roadmap for the employee.
Right.
And when they get there, they look at the plan of care and go, this is what we got to get knocked out. And in a perfect world, gentlemen, and we hit this about 99.8% of the time, I would say, our job is to find exactly the right person to send into our client's home.
So you match them.
Absolutely.
By
we do.
personality and skill?
Personality, skill, hobbies.
Really?
Interest? Absolutely. You bet.
That's great.
We've got technology that you put in the client's attributes, you put in the employee's attributes, and the soft. It's kind of like Match.com.
I was about to say the same thing. Jinx.
Jinx. There you go.
I was gonna swipe left or swipe right on this person. You know, I mean, you want somebody who's going to have something to talk to you about, even if that's not their job.
And Dave, that's a great point because depression amongst seniors is huge.
Yes.
And sending someone in and being a senior by yourself and a widower or a divorcee and being in your 80s can be really lonely. And so having somebody to come in that they can look forward to having come in really kind of helps on the emotional side as well.
It's essential.
Okay,
because
now,
the emotional health is such a huge impact on your physical health. I mean, they go hand in hand.
all right, I want to know whether I have people at home who are going to help me. I'm going through some heart issues, going to have surgery. Could I pick up the phone and call you guys if I didn't have anybody and I just need to get through a couple of months of recovery from an operation?
Absolutely, Dave. You sure can. We do short-term as long as long-term assignments. I mean, I think our longest client was up in Durham. We had Juanita for about 7 years.
Wow.
I think our shortest, we've done a lot of work in an organization that I'll certainly give a plug and a shout out to, is the hospice organizations here.
Yes.
We love hospice and what they do for families. Shortest patient we ever had, or client, was 12 hours. It was a hospice.
Oh, yeah.
Yeah. It was sweet.
Yeah, it's hard to
to
talk about somebody who's passed, but yeah, I can understand.
It's
You're also dealing with end of life issues in your end of work.
We are, and that's where we want to bring in hospice for the family, for grief counseling and
Right.
emotional support. We typically are brought in through hospice to help with the personal care of the individual,
Right.
the hospice patient themselves. So we can, we partner up with the right organizations to make sure that it's a totality of care for the whole family.
All right. Over the next couple of minutes, if you want to place a phone call right now, 919-860-9783, and talk to Gavin Densmore, the CEO of At Home Eldercare. And what's the website?
Our website is www.athomec.com.
All right, At Home EC, because I'll tell you what, I just Googled the phrase, At Home Eldercare. There's all sorts. You know what I'm saying? I didn't type in the geography, so I got all sorts of different
That's
organizations.
Is
At
there a
Home
phone number
EC.
they can call too?
Yeah, our phone number, our office line is 919-263-0989.
At Home Eldercare. All right.
And what is your geographic area of coverage? Is there a particular thing you can tell us?
We cover the triangle and the triad.
Okay. How far east, how far west?
Well, we go all the way up to Durham and Chapel Hill and beyond. And then my franchisee over in Winston-Salem covers from Winston-Salem this way over to, yes, sir. Yeah.
So all of Wake County?
Oh, certainly. All of Wake County.
What about Johnston County, where I practice?
We do work down in Johnston County as well.
Awesome.
Yeah, Johnston County, Lee County, Moore County, Durham County, Orange County.
Because there's a
surrounding counties.
lot of need where I am.
Right. All right. Now, we're going to send people to athomec.com.
Yes, Dave.
Athomec.com. And what telephone number could they call you at the office?
Get us at 919
Yep.
263 0989.
263-0989. Gavin, thank you.
Dave, thank you very much. It was a pleasure meeting you and Dr. Weefold.
Well, listen, and I'm just going to say this. The healthcare system is not just doctors and nurses, and it's people like you. Because what you're doing is what I can't do, which is be there face-to-face and support and provide love and understanding and day-to-day care. I love it.
I love my employees for doing what they do. It's we wake up, Dr. Weefold, I wake up. I want my franchise partners to wake up every morning and ask two questions. What can you do for your employees that you're not doing for them now?
Yeah.
And what can you do for your clients that you're not doing for them now?
Well,
And if
be
you
back
keep
on the show.
You keep that focus.
Okay. All right.
back
We'll
on
have
the
you
show.
back. We'll have you back.
Love talking to you.
Thank you. Gavin
Good chatting with you,
Densmore, At Home Eldercare. Again, that number is 919-263-0989. This is Heart Health Radio. Coming up, there are a lot of people being diagnosed with hearing loss, and I'll bet you figured it out.
What?
Yeah, a lot of people because everybody's wearing masks. Why would one
You
thing
just
have
gave
to
it
do with
away.
the other?
You just gave it away.
That's coming up on Heart Health Radio, and Dr. Weefold also wants to talk today about mini strokes. That's coming up, and we'll talk with Kent from Raleigh on the Heart Health Radio Network.